Good morning, everyone. My name is Anne Parle and I'm part of the Human Health and Nutrition team at safefood. I'm going to be chairing the first part of the webinar this morning. And on behalf of safefood and CCAD, I'd like to welcome you all to this morning's webinar. At safefood, we are proud to continue to fund the CFI programme, supporting communities across the island of Ireland to promote good health through programmes that engage families with food and healthy eating. The current 3-year CFI programme comes to a close at the end of this year. So we wanted to use this morning to focus on strategies to ensure continuity of community food programmes and to provide guidance on designing sustainable projects. I'd like to congratulate all our CFIs on the fantastic work they've done so far and that they continue to do. And we look forward to welcoming new community groups to the next CFI programme that starts in January. It's inspiring to see all the work that continues to take place across communities, and another significant step is the launch of this Launch Care Healthy Communities programme that takes place tomorrow. And that programme will develop healthy communities across 18 disadvantaged areas to improve the long-term health and well-being of communities. Before we begin, just some housekeeping. So our speakers are all with us live this morning, and you can ask questions via the Q&A box at the bottom of your screen. And this is available throughout the session. Everyone's question will be visible, and you can also upvote anyone's question. If you would, please include the name of the presenter that you'd like to address your question, and we'll try and answer as many as possible during the question and answer session at the end. For any technical issues, please use the chat box at the bottom of the screen, and please address these to the panelists only. You can also use the chat box to chat with the panelists and with other attendees. Finally, please note that we are recording this session and this will be available after the event. We also are encouraging everyone to tweet about the event using the hashtag #communityfood. Before we go to our first speaker, we'd like to play a short video that showcases some of the work and impact of the CFI programme. Before we start, I just want to thank you to all of the participants in the video. So thank you to the Triax Neighbourhood Management team for allowing us to come and film at a recent community event, the participants who kindly spoke on their experience of the programme, CCAD for facilitating this, and Dr. Anne Griffin from the University of Limerick, who sits on Ballyhura Development CFI steering group, for sharing her experience. So we'll play the video now.
The Community Food Initiative aims to positively influence the eating habits of families across the island of Ireland through the development of skills and knowledge in the areas of food and healthy eating.
And it's about educating people to show them that sometimes healthier options doesn't always have to mean more dear and more expensive, because particularly there that we live, there's families here on the breadline, if you like, so it allowed us to bring our own sort of spin on it in terms of showing people that there is ways to do it which are healthier and more cost effective.
We go directly to communities as it allows us to deliver our messages direct to families in an accessible way. There are two main elements to the programme. The first are small projects. This involves taking a group of participants and working on improving their skills in a particular area over a period of time. The next are community events. These are wider events that happen with the support of local community stakeholders, and they allow the delivery of messages through demonstrations and discussions with a wider audience.
So the role of the steering group is to provide guidance and oversight to the community food initiatives, making sure that evidence-based practice and consideration of community needs is at the forefront of those events.
The programme offers the community the chance to improve skills and knowledge around healthy eating. So these are skills in the areas of cooking, shopping, budgeting and food safety. These are tangible skills that are transferable as well and have an impact on the wider community.
By working with the families and using food as an engagement tool, it opens up a lot of different avenues around family needs. If you like, it's a bottom-up approach to encouraging and supporting indeed healthy eating choices and active living choices.
Getting all the community involved. We've done projects from families and individuals, and basically just getting everyone in the house involved. Not only is it addressing the issue of food poverty, but it's also about that social interaction within the families and within the communities, and just making people feel part of the community while also addressing the very serious issue of food poverty within our area.
The children took part in the whole project. It was a hands-on approach, so they were understanding the importance of the foods they're cooking. Then when they taste it, they have made it. It was very successful, and I think it's very important for a community of this nature.
Us as a community come together and meet other parents and see what they're doing as well in their homes. I think events like these are definitely worth coming to. You're coming into the community, you're getting involved with the people in the community, you're getting to know your local representatives who are then encouraging you to eat healthy, they're encouraging you to mix as part of a community, and it's a very nice place to be. It's very happy, it's very calming, and it's great for tips and tricks too for at home.
I think they're really good for the community. It helps mothers like myself understand like stuff that like not realising how much sugar goes into a lot of the foods. Things like this has helped me on doing cooking on a budget. I've done a lot of courses through healthy eating at the minute, and I find them very, very helpful.
We did a sort of weekly cooking video, if you like, demonstration on a closed Facebook page, and what we did, we went out and delivered the packs.
Those families then videoed themselves cooking them and put them online for us to see and give us the feedback. The feedback was absolutely fantastic.
The programme also has a wider impact on health. So for example, during the COVID-19 pandemic, participants reported improvements and benefits to mental health.
Thank you. So you can find more information on the CFI programme, including that video, and also a booklet sharing case studies from each of the community food initiatives on the Safe Food website. We'll also share links to these after the event via email. You'll also find a range of online, video and print resources that can be used part of programmes on our Community Food Hub. So now it's time to introduce our first speaker. And I just remind each of the speakers as it comes to your turn to please turn on your camera and mic at the beginning of the presentation, and then when we come to the end of the presentation, please turn them off again. So our first speaker of the day is Jennifer McBratney. Jennifer is lead dietitian for health development for the Southeastern Health and Social Care Trust and currently chairs the Public Health Dietitians group in Northern Ireland. Jennifer is going to provide an overview of the current community nutrition education programs with a focus on slow cookers, food values and Cook It, and how these have been adapted to be delivered in a virtual world. So I'll hand over to you, Jennifer.
Lovely, thank you, Anne. Thank you for the welcome, and thank you to Safe Food for asking us to come this morning. And I'm just going to share my screen here to get us started. Okay, can I check that that's okay, Anne, with the screen? Yes, you can see.
Yep, I can see that.
That's lovely, thank you. As Anne said, I'm also the chair of the Public Health Dietitians group, and we're a group of dietitians and nutritionists that are based across the 5 health and social care trusts within Northern Ireland. So within the next 10 minutes, I'll hopefully give you a bit of an oversight of the programmes that we deliver up north and how they've been adapted to be delivered during the pandemic as well. Okay. Oh, sorry, it's just maybe not. Oh, there we go. For those of you that are based up north, many will be familiar with the programs that we have in place at the moment. So prior to COVID, we would have been delivering a lot of these face-to-face by training tutors up in many of our communities and voluntary sectors. So Cook It is our 6-week cooking skills program that looks at recipes and cooking skills and healthy eating with the Eat Well guide. Food Values then is a 4-week cooking skills program that really focuses on food budgeting and also shopping tips and ideas for how to be savvy with how you do your shopping. Good Food Toolkit is more of a generic program that can be picked up and delivered by many communities in different aspects of when they're looking at particular parts of healthy eating. And then I Can Cook It is our 8-week program that has been used for sort of those with learning disability, but also it's there for those with a wider sort of need around that as well. And Solid Starts is a program on weaning that's available within the Southeastern Trust and the Western Trust as well. So many of these programs have been running for a number of years, but obviously with COVID, many of our communities and organisations where our tutors are based had to sort of adapt and change, and we spent the first part of COVID is, as our group, really adapting some of our programs to be delivered on a virtual platform. So food values and Cook It and Good Food Toolkit were all adapted to be delivered via Zoom or a virtual delivery mechanism. And many of our tutors, I think we trained over 120 tutors that were originally delivering it face-to-face, were able to be trained in the virtual delivery and deliver them to the communities during the last year and a half. COVID also gave us some extra things that we wanted to do to support our communities. Cook It and Food Values in particular are cooking-based programs, which were often delivered face-to-face, but obviously whenever we went to virtual and over Zoom, it was more of a challenge to deliver this aspect of the program. So our teams within all of the 5 trusts got our heads together and we decided to come up with recipe videos, so time-lapse videos, which many of you will be familiar with and would have seen across the websites. So there are 27 videos that were produced to support the Cook It program in particular. We also have 4 videos that support the Food Values videos as well. And these are all available on the Public Health Agency Vimeo site. So they are available for those outside of the programs. So across the island of Ireland, you can access these recipe videos. So certainly I would encourage anyone to take a look at the videos. That's the link to the video recipes there, but it is on the Public Health Agency Vimeo. It's not sometimes the easiest to find. So if you're wanting to have a look at it, what I would suggest is that you Google Public Health Agency in full Vimeo. That will take you directly to their website, and then you'll have a look at the showcases. And on page 2, you will see all of our videos as well. So they're there to be used across all communities, regardless of whether or not you're delivering the Cook It or the Food Values program. So those were really a useful tool for our communities during COVID, where maybe they weren't able to do the face-to-face programs, but they were able to deliver sort of cooking in people's own homes. This is a new program that was developed during COVID, and this came as a need from our Department of Communities, and many of our Healthy Living Centres have been involved in delivering our slow cooker program, and particular trying to sort of target those communities most in need. So we have a program around slow cookers, and there's 2 elements to this as well. There's a bite-sized version, so for those who are maybe just not quite sure or have a slow cooker in the back of the cupboards and just want a bit of a reminder on how to use it, the bite-sized program really takes them through that with a little bit of information on sort of recipes and ideas as well. But we also have a longer 4-week program, which is delivered through Zoom in and around about sort of 30 to 40 minutes of a session that takes you through sort of healthy eating, how to use your slow cooker and sort of ideas. And there is a recipe book that comes with this as well that was delivered to each participant that included 6 of our recipes for slow cookers, and we're looking at developing more for this as well. And similar to the Cook It and the Food Values videos, we have the 6 slow cooker recipes available on the Public Health Agency Vimeo site. So again, they can be accessed by anyone in any community to use as they want to. So it proved a really successful program, and I think it's planned to be delivered again this winter time as well. But also what we realised at the start of COVID, we did a scoping exercise with our tutors in the communities just to get a bit of an idea of really what were the challenges that they were experiencing during COVID, what were the sort of needs for their communities. And this scoping tool really led us to look at developing a suite and a series of regional sort of webinars that are accessible for the public. So people in communities were asking us for evidence-based nutrition and to be able to look at certain topics, in particular of childhood nutrition, you know, food on a budget, food and mood, and other topics as well. So over the course of the last year, as our group, we've developed 11 webinars. And these are delivered live, 4 a month are delivered live by dietitians and registered nutritionists across the north. And anyone can access them. Most of our Health and Social Care Trust and the Public Health Agency through the social media challenge. If you just want to follow them, you will see them advertised every month, and each of the topics change from month to month. But obviously we also are aware that not everyone is able to attend. So each of the webinars are also recorded and they are available again on the Public Health Agency Vimeo site, so they can be accessed at any time as well. So again, if you Google the Public Health Agency Vimeo site, you will see all of our resources that are available there, and they're free to use for anybody in any community across the north and probably across the island of Ireland as well. So those healthy eating webinars have been really successful. I think at the moment we've delivered to sort of over 1,000 participants live, and there are many hits from the recorded webinars as well, and they're on a variety of topics. We're continually developing them, and we're adding to sort of this suite of webinars that we have as part of our remit to try and get evidence-based nutrition to the general public as well. So how do we access a programme? So a lot of our programmes are available, of course, in Northern Ireland as such. So our Cook It, our food values, our I Can Cook It and Good Food Toolkit are delivered by a train-the-trainers model. And that did, prior to COVID, was a face-to-face training programme of 1 to 2 days, depending on the programme of choice. But of course, with COVID, we weren't able to deliver this. So this actually gives us a little bit of a breathing space to look at how we take forward our training programme going forward into 2022, where hopefully we're able to sort of deliver a combination of Zoom and face-to-face programmes as well. So we plan to have a new training framework that will come out for next year. So if you are a community in the north and you're interested in any of our programmes or delivering any of our programmes, what I would say is in the next slide, I'll have the email addresses and telephone numbers for your local health and social care trust, dietetic department, public health dietitians. And if you just wanted to drop them an email or give them a call, then we can add your name to our waiting list. So we're hoping that really from April next year that we should be able to deliver a range of programs. We're just really looking at how we do that. And how we sort of make it a bit more sustainable for delivery as well. What COVID has taught us as a group is that really social media is our friend as part of this. So delivering our webinars, our sort of infographics around healthy eating has been really successful. We're looking into possibly having our own YouTube channel to make it a little bit more easier to find our programs and our recipes and our webinars as well. So certainly I see that it's new skills that we've developed as a group as part of COVID, but certainly it will have a positive benefit on our communities and hopefully make our programs and our communications a lot more easier to communities and those people within their own homes who want to access reliable evidence-based nutrition and look at different topics as they go along. So as I said, we're based across the 5 health and social care trusts. So the one that you are based in, you will see they've got the Belfast Trust, the Southern Trust, with the Northern Trust, the Western Trust, and then my own trust in the Southeastern area. So I'll leave that sort of on for a minute or two, but hopefully the slides will be available and this is recorded as well. So you'll be able to take a look at that and have the details for you to be able to contact. So hopefully the presentation has given you a bit of an insight into the programs that we have and that are available to be delivered in Northern Ireland, but also some of the developments that our group has taken forward with the opportunities that COVID has presented with us with a virtual format and the delivery for all. So thank you very much. Thank you.
Thank you very much, Jennifer, for that. And if anyone has any questions for Jennifer, please put these in the Q&A box and we'll come back to these during the Q&A session at the end. So our second speaker this morning is Adele McNamara. Adele is a senior community dietitian in the Health Promotion Service of Dublin North City and County of the HSE, where she's worked for 19 years. Adele is responsible for the management of the Healthy Food Made Easy programme and coordinates a national network of HSE dietitians involved in the delivery of this programme around the country. And Adele will be speaking about the Healthy Food Made Easy programme and how it's managed and delivered nationally. Thank you.
Thank you, Anne. Just trying to share the screen there now. Here we go. Good stuff. Just before I start, just to clarify there, I don't manage the programme nationally, although I do coordinate a group of dietitians who are involved in the programme. But I manage the programme in North Dublin. So I'm based in North Dublin. And I manage the Healthy Food Made Easy program there. So when I was asked to speak about at a conference around designing community food programs at last, it sort of struck me that the Healthy Food Made Easy program, which I'll go through just in a sec, it's been around for a long time, and I always, you know, when I'm talking to people who haven't heard about the program, I always mention how long it's been around. But I suppose I never really had to consider the factors or the reasons about why this program has been on the go for so long. So it was an interesting exercise for me to reflect on that and to try and come up with those elements of the program that has made it last. But just for those of you who aren't familiar with the program, it's quite similar to Cook It, as Jennifer has been talking about. It's a 6-session program, usually carried out over 6 weeks, which covers the basics of healthy eating and simple cooking as well. It's delivered by trained leaders like Cook It and small groups of about 7 to 15 normally. And the key is that the emphasis is on group learning. It's not formal teaching. It's mostly around conversations and discussion, some quizzes and problem solving games and activities. And there is obviously the enjoyment then of participating in the preparing and the cooking and the tasting of foods. We have a standard suite of recipes like Cook It as well. And a key element of this program is that we endeavour where we can to have a dietitian visit on one of the sessions, normally the 5th session of the program, to answer various questions that have come up during the program delivery. So when I began to sort of reflect on the program, I went back to the start and to find out where the program, you know, where it came from. And it started in the early to mid 90s. So there was a small grant given to an area of disadvantage in Dublin 15 in Mulhuddart. And there was a dietitian employed there for a short period. Sharon Foley was her name. She's actually the Irish Hospice Foundation CEO now. And she developed the program there. And from the start, it was a peer-led model. You know, at the time, someone told me last week that Tony Holohan, who was our Chief Medical Officer, as many of you know, at the time had just started in Dr. Stevens in the Eastern Health Board. And he analysed some of the initial data on it. So I thought that was an interesting piece of information. But in 1998, dietitians were recruited in the various health boards, as they were called at the time, with a brief around low income and nutrition. So that helped to kind of keep that initial project that had been developed in Mulhuddart to keep that going in certain parts of the country. But really, it was when in 2000, after the Building Healthier Hearts cardiovascular strategy, after that was launched, where that included significant increase in the level of community dietitians employed in health promotion services around the country. So that enabled the programme to scale up and reach more parts of the country. So I guess I wanted to sort of, I thought about the various elements of the programme that has led to its lasting or sustainability. And so these are in no particular order, but the first piece I think is important is the programme impact. So we've done various local evaluations, and there's been some formal evaluations over the years. And I think there's some international evidence as well around this type of programme. And we do know that there's evidence of increased cooking confidence, reduced intake of takeaways, and increased fruits and veg consumption, increased or improved nutrition knowledge. So we have seen that in the programme. But what's much more difficult to measure is the power of the programme. I'm sure you see this in Cook It as well. In terms of its effect on the social connectedness for the participants in the programme. And I think the power of that then has an impact on everyone involved in the programme, and it really does inspire people to want to continue to have this programme delivered in their communities and in their agencies. Okay. The second thing that I think has led to the longevity of the programme is the very strong partnerships that the health boards and now the HSE has developed with community organisations who deliver the programme on our behalf. So we work with organisations that align with the cultures and values that we have, and we have developed very strong relationships with them over the years. primarily those relationships are between the HSE community dietitians and health promotion service and those agencies. So here in North Dublin, we work with 4 agencies. One of them, I just took this from the website, Northside Partnership. You know, we work to improve the opportunities for people and communities in North East Dublin to bring about positive changes to their own lives and in their community. And that's what we want to do too. So the partnerships make sense. And I think that has been key to the longevity of the programme. The next thing I think that the programme couldn't exist and continue to exist without is our committed community-based coordinators. And I know there's at least one of them here. So hello, Suzanne. These are paid coordinators who duties include, and I'm sure Suzanne is looking at that list of duties saying it's a lot longer than that. They really do have a huge range of duties but essentially they're responsible for the day-to-day operations and organisation of the programme. They support the trained leaders who deliver the programme, and they are the key liaison with the HSE. So without this dedicated person based in our community organisations that we partner with, I think it would be very difficult to sustain this programme in the long term. The other key element of it is the HSE community dietitian, and again we have it's a small number relatively speaking of dietitians around the country, but they're key in terms of training the peer leaders, visiting those week 5s of the programs, renewing resources, liaising with coordinators, providing refresher training, gathering KPIs, and all that sort of the work that's required to sustain a program like this. So without that intervention, or without that work from those community dietitians, I'm not sure that this program could continue. But more importantly, again, is our program leaders. These are the people who have been trained to deliver this program, and they do it so well, and they really are integral to the success of the program. And I think it's interesting, it's key that so many of them have been working on delivering the program for several years, and I think that speaks to the passion that our peer leaders have, because they enjoy. It's an enjoyable program to deliver, and it's enjoyable for the participants. And many of our peer leaders have gone on to become coordinators, and from coordinators they have gone on to other employment as well. So it's the program leaders they're a fantastic group, and they're key for the sustainability of the program. Obviously, without sustained funding, programs like this would be extremely challenging to sustain. And so although the model of funding for this program varies from place to place within the Republic of Ireland, and also over the years it has kind of changed. Essentially now we are in a situation where it's primarily funded by the HSE. Over the years there have been Healthy Ireland funds available, Sláinte Care funds, safefood obviously with the Community Food Initiative have funded some of these programs. And Anne has mentioned the launch tomorrow of the new Healthy Community Initiative, which will see the rollout of this program and other types of programs in 18 different areas. So we hope that this is the start of a new journey, or a new era for this program as well. But the sustained funding, the program does cost to deliver this program in terms of the food and the funding for the peer leaders. So that's essential. The other piece as well has been, although Healthy Ireland wasn't in existence when this program started, but in terms of the sustainability of the program, the fact that so many of the Healthy Ireland plans, be it from the HSE areas or our local authorities or our SIPCs, have included the delivery of this program as part of their plans, that will be key, I think, as well to the sustainability of the program. And lastly, I mean, maybe some of you in the audience there have other suggestions for what makes this program so sustainable. But we do have, in a kind of a cookish sort of a way, strong links with non-grant aided organisations as well. So these will be organisations and places that we work with that we don't grant aid to deliver, but they deliver within their organisations with trained staff to service users. So that would be things like post-primary schools, for OIGA and other organisations like that. The programme is also a key element of the Sheds for Life programme with Men's Sheds as well. So these are the various elements just put together there, and yeah, I was trying to think, you know, could it survive without any of them? And I don't know that it could, but it's also hard to know which was the most important. I was trying to rank them, and I don't think I can rank them. I think they're all of equal importance, and if you want a program that lasts, that's sorry, I've lost connection from my screen share. Apologies for that, but that was my last slide. And essentially, I suppose all of those elements are really important. Thank you.
Thank you so much, Adele. That was fantastic. And again, if anyone has any questions for Adele, please pop them in the Q&A box and we'll come back to them at the end. So on to our next speaker, and next up is Julie White. Julie is the Healthy Lifestyle Coordinator and Project Manager of the SWEET project at the Old Library Trust Healthy Living Centre in Derry, Northern Ireland. They provide programmes and services that give the community the opportunity to live a happy and healthy life. And this morning, Julie is going to discuss the work of the Food and Nutrition Working Group of the Healthy Living Centre Alliance. Over to you, Julie.
Yeah. Thank you very much, Anne. Good morning, everyone, and thank you for having me. So hopefully you can all see the screen in front of you. So today I'm here to speak up on behalf of the Healthy Living Centre Alliance Food and Nutrition team, and again to highlight the work and the contributions that we have together and how we bring individuals together to work to a common goal that they can develop, support and enrich the programmes and services that have been offered throughout our communities. So the Healthy Living Centre Alliance, what is it and what do we stand for? So it's an award-winning network of 29 community-led health improvement organisations based in areas of high health inequalities throughout the north of Ireland, both in rural and urban areas. It is a key driver in connecting people up to the services and linking to the both health sectors and wider public sectors of working class communities. The Healthy Living Centre Alliance places great value on the community development and the assets-based approach to health and wellbeing. Our members strive upon empowering people to be more control of their personal health, promoting ethos of peer-led self-management for people for long-term conditions. We value collaboration from all sectors and organisations to help reach those that we consider most at risk and seldom heard of. Our network of grassroots health improvement projects is willing and eager to play a greater bottom-up role in transforming health status of our people and involving a form of over-reliance upon health service to become more fully engaged, informed and confident in self-managing many of the health conditions. The Food and Nutrition Working Group is one of the 5 key groups of the Alliance, and it is developed in striving for better health and wellbeing of our local communities. So the role of the Food and Nutrition Group is to enable healthy living centres to adopt a proactive policy and positive practice within their communities, promoting and facilitating a healthy approach to food and nutrition. The working group has been established and is created of a host of members from the community and voluntary, education, statutory, local authorities from across all 5 trust areas in Northern Ireland. And as a collaborative group, we work together to support our local communities with the knowledge, resource and expertise of our members to create a multidisciplinary team. Along with each Healthy Living Centre, we have a key point of contact that we can share any developments, updates and changes to policies, programmes and any influence that they can bring towards our group. Over the last year, we've been working together and being committed to ensure that we continually progress and create impact that can help support and improve the local people across all areas of communities. Most recently, we've been working on our nutrition policy. So we've developed a manual and policy that will guide each Healthy Living Centre to promote a good nutrition practice within their centres regarding their programme delivery, whether they're hosting events. We provide guidance step by step that can help those maintain good nutritional practice. We're currently developing social media nutritional awareness days, establishing a calendar of relevant and important nutritional health and food awareness messages that can highlight key nutrition and ensure that each centre is sharing the same message across social media channels. In providing assets, text, links to further information, we aim to create a trend and impact by promoting across all sites. And finally, our nutrition delivery and support is a key aspect of our group and our working group. As a group, we meet to discuss and coordinate the best practice and model to support the rollout of funded programs. We assist with connecting our health development centres to dietitians, nutritionists, key information and resource. We highlight key training opportunities that are provided through the range of sectors. And we share and update relevant messages that keep our key points of contact updated on key and relevant information from each health development centre. In 2020, safefood and the Health Development Centre Alliance in Northern Ireland teamed up to support families in delivering a campaign called Transform Your Trolley. This was focused on providing nutritional programs that highlighted key messages on how families could transform how they shop, prepare and eat their food. We had a range of health development centres involved from both urban and rural communities that delivered this online campaign and digital delivery. Following the success of the campaign in late November of 2020, the Alliance was then successful in further securing funding to support the programme in its delivery early in 2021 through the Department of Communities. The delivery of these two programmes has provided key recognition on the efficiency and the quality of the partners within the Alliance group, and in creating a working group based on our experience, knowledge and expertise has created a strong foundation in implementing the successful programmes. This has allowed the Transform Your Trolley to be supported and in partnership with safefood to be rolled out through the Alliance wide and to even more communities this year, with the help and with the aim to help and improve the health and knowledge of more people further afield. So one of the main strengths and challenges and even future endeavours of our working group. Our strengths, we have a wide team of versatile staff of members from the University of Ulster to the Food Standards Agency to Trust dietitians and health development centre staff. They all provide a wealth of knowledge and experience that can create and impact a lot of the implementation and work that we aim to do. We have great relationships with Trust dietitians, Food Standards Agency and safefood, that we have a great working relationship that we can deliver high quality and well implemented programs across all sectors. We have interlinks with nutrition and programs across all health development centres, maintaining that each health development centre is delivering some form of nutrition across all the programs within the year. We have influence of food nutrition training for staff within the health development centres. Again, this is linked to providing and highlighting the training opportunities that come from multiple sectors that we're engaged with. Our challenges, as ever, is unlike most of our other working groups, we don't have a dedicated World Health Eating Day or Nutrition Day. So we're always trying to implement a way to promote the messages and key messages around health and nutrition and food, and trying to always raise the profile of the importance of maintaining a well-balanced diet and lifestyle. Again, funding is always ever changing and challenging, but again, we're always providing training and opportunities and budgets to help provide at least a cost-effective approach to delivery through our health development centres and members. Our future endeavours is to provide a specific day for health eating and awareness raising, or a health eating week across all health development centres. So as one unit across 29 centres, we can promote food and nutrition on a specific day and time or week that can highlight the key messages that are coming across, and again interlink many people living within the north of Ireland to these key resources, whether it be dietitians, Food Standards Agency and our key members list. Renewed and implemented nutrition policy. So we're hoping to renew and implement our new updated policy. As you know, we've had COVID, we want to update and keep information relevant to all our members. So this is what we'll be implementing in the next few months ahead. A well practice in the health awareness programme. So we want to implement, we're only at the beginning stages of our awareness days. We want to have a well practiced and relevant social media campaign across this. And as we practice, we will get stronger and hopefully make this more of a trend as we go forward across the years. And again, we're always endeavouring to strengthen the partnerships and connections, whether it be through funders, be through statutory bodies, be through local authorities or dietitians. We're hoping to always strengthen those. So again, that our influence can impact the people that are living in our communities. And nutritional content. So again, we're hoping they always have influence and promote more nutritional content across all programs within that is delivered across health development centres, whether it be connected to mental health or connected to physical activity. We want to have some influence with nutrition. And just to highlight some of the achievements, again, we have a nutrition policy that is implemented currently. across all our health allowance centres within the Alliance. Again, we're hoping to update and make it more relevant in terms of new legislation. Again, we're working on a national healthy eating campaign with safefood. We have monthly nutrition awareness days, and again, we're incorporating a nutrition module into the Better Days chronic pain programme, which is one of our key working groups as well. So thank you.
Thank you, Julie. That was fantastic. And I can see we're getting questions into the Q&A box the whole way through there and throughout the other presentations. So please keep those coming as well. So our final speaker this morning is Mary-Therese Doherty, who's a secondary school teacher of modern language working in Carndonagh Community School in County Donegal. She's also a member of the Inishowen Family Action Network Steering Group, and her presentation will share the role of the steering group in supporting the work of the Community Food Initiative. So I'll hand over to you now.
Thanks so much, Anne. I'm just going to share my screen here, folks. Good morning, everybody. Hope you're all enjoying the presentation so far. I sure am. 1 second. Here we go. All right, so as Anne said, my name is Mary-Therese Doherty, and I am the Homeschool Community Liaison Coordinator here in Carndonagh Community School. And I'm here today to represent the IFAN group and to speak to you about the impact of networking and building community connections through the Community Food Initiative. Okay, so just a little bit of background information first of all. The Inishowen Family Action Network is a network of community and voluntary groups, statutory agencies and school representatives, and is chaired very well, might I say, by the Inishowen Development Partnership. As a group, we meet at least 6 times a year to share information and update members on relevant issues and projects that are intrinsically linked to the network's vision. In this way, we raise awareness of current issues and challenges and facilitate the coordination of service delivery. We do a lot of work in family support as we recognise that families are at the very centre of our work, and IFAN follows a rights-based approach. The main purpose of our meetings is to maximise opportunities for collaboration in order to more effectively and efficiently deliver family support and community health services. We aim to create an environment for a joined up and integrated approach to supporting parents, carers, children and young people living in Inishowen. And I have to say that IFAN has been an absolute beacon of hope to the struggling families in our community over the years. And it is through this base of care, support and collaboration that IFAN has been the steering group for the CFI for the past number of years in the delivery of the programme. IFAN has been the launchpad for the project in planning the pilots and networking events. And these events have been instrumental in building connections within the community, getting the word out there, and the very success of the programme itself. So these are just a couple of the ads that we would have run or put out there regarding the Community Food Initiative. And from our experience in this field, we just have a couple of helpful tips and hints on how to ensure success and uptake when you want to run the programme. So first of all, go to the Safe Food website itself, because actually they have some really fantastic resources. So there's no need to recreate from scratch. You can kind of just tailor the materials that are there to suit your local groups. The next thing is piggyback off of other existing events that are happening. We have an event in County Donegal called Wayne Fest. That's it runs over a week and it's county-wide, and it kind of highlights the arts and literature and promotes elements of those fields. But we hopped on board and added safe food and eat right stalls with cooking demonstrations, and local suppliers were showcased throughout that time as well. And I suppose we've added a lot of meaning to the saying, if you feed them, they will come. Make the food available, have it there, you know, tasting, the demos, all the rest, have it there available for them. Even the smell of it brings people to you. Another thing to bear in mind is to be creative about boosting your event. Use indoor settings, outdoor settings, use marquees, use what's available to you, get live music. Again, you want a bit of an atmosphere about the event. Even local celebrities. You'll see here to the right hand side of the screen that one of the events that we ran was called the Vegetarian Brunch with the Henry Girls. So the Henry Girls are a local celebrity music group, and it was great to get them on board, and also sometimes when you have people that the community knows and they're fond of, even advertising that they're going to be there brings extra people to the event. The next thing I would say is use the platforms that are available to you. Get on your social media, Twitter and Facebook. Use your emailing systems within your community groups. We have over 100 different members on the IFAN community. And so once those emails go out, then they spread further afield. There's like a web effect then, and they go all over the place. And so the word gets out there quickly, as well as things like creating the physical visual posters to put up in the local shops and everything. And also I would say whenever you're putting together these events, make them as inclusive as possible. So involve people from your minority groups, such as those from your migrant communities. An example of this that we have done is a taste of Syria. We had people from our Syrian community come and cook for us. And it was a great, actually, we were killing two birds with the one stone there. We were able to support the families who needed it most. And also we were promoting a healthy variety of foods for people to eat. Okay, so now the COVID-19 pandemic really threw a spanner in the works for all of these lovely, well-attended gatherings. But the hearts and brains around the IFAN virtual table got together to reevaluate. And we talked about how people were stuck at home anyway, that they were cooking all the time anyway, because they had to eat. But they were getting bored of what they were cooking and they were looking for new ideas, new things to cook, new meals to prepare. And so the Inishowen Development Partnership successfully then brought the CFI programme online and had some of its greatest successes. Those who engaged sent us pictures of their finished masterpieces with great pride. It brought a community of very vulnerable and isolated families together. And in fact, from my point of view as a HSCL coordinator, the dropping off of ingredients on a weekly basis was a great opportunity for us to go out there and make those doorstep home visits, which were a great chance to check in on the families that we were most concerned about. The programme linked in with a number of IFAN organisations, including Spríoga Sport, the Exchange, the Men's Shed in Carndonagh, the Moville Family Resource Centre, the North Inishowen and South Inishowen School Completion Programmes, as well as family support workers and other HSCLs from the other schools. Our main learnings through the CFI programme were that, first of all, it's a great way to connect with families who may not traditionally be involved with any other services. Sometimes there are families we know need some support and help, but they don't reach out. This one, the Community Food Initiative, was a great way to get out there in a very non-imposing, non-threatening way to just get people to connect in a community. The social connections were strengthened, emotional health and well-being were positively impacted, especially through the COVID-19 pandemic. Piloting the Community Food Initiative online led to opportunities to reach out with other supports, because when we realised how well it worked online, we were able to get other supports out there, various different mental health workshops and different things. We realised then that people, once they learned how to connect online, did very well with the other things that we put out there. Community connections were strengthened through the collaboration on the project. I'd have to say that it has been an absolute pleasure to be involved with such a solution-focused group of people with such big hearts. I know that a lot of times in groups like this, we sit around and talk about problems a lot. And while we do that at IFAN, when we do that, when we've talked about the problems, immediately we're focused on solutions. It's not enough to just empathize with the people, but to get out there with, you know, proven events that will help, proven things that we can put in place for them. That's exactly what the Community Food Initiative has done. So for us in IFAN, rolling out the CFI has been a very valuable and worthwhile process. And that's all for me today, folks. Thank you so much for listening. I'll go and hand back to the team.
Thank you so much. That was fantastic. And we've lots of good questions coming in now as well. So I'm going to actually hand over now to Ryan Howard, who's going to chair the Q&A session. Ryan is the Chief Executive with ZCAD Partnership, a rural development NGO located on the south coast of Ireland. Over the past 10 decades, Ryan has managed a team of experts in ZCAD to develop linkages between public and private investors and beneficiaries involved in sustainability initiatives, social inclusion and rural development. And since 2016, ZCAD has managed the Community Food Initiative on behalf of Safe Food. So over to you, Ryan.
Thank you, Anne. And welcome everybody. Hopefully all is clear and you can all hear me fairly clearly. I've had a couple of small technical issues here this morning, but just I suppose to start with, to thank everybody for your participation, great presentations, and I want to thank Anne and the CFI team, particularly ourselves, Joanna, Caroline, and all who are behind the CFI initiative. Because all of us who are working at local development know how important it is to have somebody like safefood to believe in us, to support us, and to help community-led initiatives, to bring this kind of partnership up and to do something extraordinary. And that's what's happening here. And just to say thank you for being part of that, to all the panelists and to everybody who's here. So I'm just going to take the question and answer session, if you don't mind. I'm going to start with Jennifer. I'm going to go in order of the presentations to start with. So for each of the panelists, if I can ask a question, and again, thank you for your presentations. Jennifer, can I ask you briefly to describe why Cook It works so well and how that shaped the development of other community initiatives? And maybe Jennifer as well, if you could take a moment to talk about, I suppose, the challenge, I suppose, on this whole using this type of media online and try to carry courses through online and bringing it back to a face-to-face and trying to, I suppose, reinvigorate some of the magic that's there as well. So Jennifer, thank you.
No problem. Thank you, Ryan. Cook It, I think, has been embedded in our communities for over 20 years now. So as Adele said, it's quite similar to the Healthy Food for All program. So we've been delivering it across all communities for a long time. And I think why it works so well is it has such a practical aspect of it. So it does very much focus on cooking skills and the fun involved. I think it's called Cook It Fun Fast Food. So it's around the social interaction, it's around cooking together, and as well having that opportunity to sort of learn a little bit more of a knowledge around that. So it's been there for a while. It's been our first program. And then naturally, as things moved on, and certainly particularly when we saw the rise of food poverty, which is very much in our minds at the moment, that's kind of led on to our food values program. So we sort of made it a little bit shorter, 4 weeks, because some of the feedback was that actually the 6 weeks sometimes was a bit of a challenge for participants to stay engaged with. So it's a 4-week program, and it very much is focused on food poverty and looking at food budgeting skills, and as well keeping that sort of aspect of cooking. So what we're really trying to do in the Northern Ireland as part of our regional group is try to sort of standardise our programmes across all of Northern Ireland. So no matter where you are and what community you are, you're able to have access and deliver our programme. So that sort of has been our sort of mantra for the last few years, to try and embed that. The challenges with COVID, very much so, all our programs are very much face-to-face, the cooking aspects, the social interaction. So whenever COVID happened, that really stopped. And it did sort of give us a bit of a time to think about, what was needed, how do we sort of engage differently with our communities. So the sort of programs, Cook It and Food Values and Good Food Toolkit, are all available online for Zoom and delivery. So we did spend a bit of time looking at a program, sort of adapting it, changing it, and that led on to the recipes, the time-lapse recipes, and they have been really fantastic resource. And what we've been able to do, and what COVID has allowed us to do as well in Public Health Agency, is to share that wider than our programs. So there's over 40 recipes that are available from our programs, the Slow Cooker, Food Values, and the Cook It, that are available there for communities to use. So that's been something that's been really quite positive. Going forward, I think as communities, there will be many here online, I think we all miss the face-to-face aspect of delivery. So I think going forward, we're looking at a blended approach where some of it can be delivered still via Zoom, but actually there is the need to sort of have that face-to-face aspect around that. So I think, like all of us, we're a wee bit zoomed out at the moment. We thought we wouldn't be here still at this stage. We'd be out in our communities delivering, but I think going forward, it will be more of a blended way around that.
Thank you, Jennifer. Yeah, I agree with you. I think it's that it's a new learning again, isn't it? It's like we take ourselves into another level of how to maximize the use of these technologies, and at the same time allow for that closer interaction, that buzz, that kind of feeling, and that when you're sharing something together in that space and that proximity. But brilliant, well done, and thank you so much. I'll be back hopefully in a couple of minutes. Jennifer, there might be more questions coming back towards you. Adele, Healthy Foods Made Easy. Brilliant program. Again, I suppose part of it, the question is relating to this, I suppose, the challenge in terms of bringing it forward from from where it's at the moment and into the future. And I suppose the question is, where is the information? One of the questions we have in here is, where is the information on the course, and how can community program coordinators best engage with it? So
I think that the opportunity we have now in terms of going forward, it really is in the community, the Healthy Communities Initiative, which is being launched tomorrow, and that's secured funding for 2022 and hopefully beyond for 18 new sites. We will continue to receive the same funding, the sort of the legacy historical funding that we've had for the programs that have already been running. So yeah, that's the future, I think, for this program, is embedding it in the Healthy Communities Initiative. So the other question was, how do people find? Well, I guess the issue, the challenge sometimes with Healthy Food Made Easy is that there's 9 there's 9 HSE areas, and the setup and the funding is slightly different in each area. But for the area that I'm in North Dublin, for example, we grant aid 4 different community development companies to deliver that program for us. In other areas that hasn't been, that type of funding hasn't been available over the years, so they have established other ways of delivering, similar to the Cookish model, training people who work within organisations to deliver to their service users. So really, if you want to find out more about the programme, my advice to you would be to contact your local health promotion service in your local HSE area. I did anticipate this question, and there is no, we don't have a link. There's no page on the HSE website, unfortunately, with the 9 areas with the link person. But you know, if you a bit of googling should find that. But you're looking for your health promotion service in your HSE area. If you look on, well, actually, the other place you can look at is hse.ie/community cooking. Now that will bring you to that we're working on that page at the minute, so the content there is a little old, but that might be, there's email addresses and contact details for the community dietitians that are involved in the program, and if they're still there, they'll be able to signpost you to where to go to find out more. But essentially, for a lot of the areas, because we pay our tutors, our peer leaders, to deliver the program, it's a funded program, and that is, I think, a key to the success of it, and the sustainability of it. That we get to deliver in the areas that we want to deliver in. We have a coordinator who can engage in the community that they work in, form links and establish links with the groups that we want to work with, and then deliver the program to them, not necessarily annually, but on an ongoing basis to different users of those services. So we trained up some new peer leaders last week, actually. That was our first time doing that training online. Somebody else mentioned that earlier as well. I think it was Jennifer talking about the Cookish training. So we hope that we will have a national offering in terms of peer leader training going forward too. So that's another change.
That's brilliant, Dara. And you've mentioned some really important elements to the success, I suppose, in terms of this process going forward. It's the link to mainstream funding and support. It's the link to partnership. And I think the great work that you're doing there in Dublin should be mirrored across the country in terms of that partnership with the local development sector, because it is at that trusted level that you then get targeted work with the community, and the possibility of expanding that further into support and sustainability. So brilliant work, well done. Julie, can I turn to you if it's okay? And the question here is on the topic of social media. Can you provide more detail on the type of content you're looking to share, and who is your target audience and goals? There's a lot in that. There's actually about 4 questions, but Julie, over to you, no problem.
So our main content on social media awareness days is basically they highlight the key visuals. So basically our content will be visual support in terms of supportive message and infographics regarding those key awareness days. So our last one, which was last month, was based around food and mood. So basically how food and nutrition can affect our mood. So basically we just had a poster of information in terms of top tips that can highlight the types of food that can effectively improve our mood and our mindset, and how it's linked to things like anxiety, and how we can help improve that with having a good diet. And again, it's also sharing links to all resources that are more that are gold standards within those fields. So if it is, getting a resource from Food Standards Agency, they're a good one of our contents within our group, sharing those resources and making sure we're providing well established and approved sound nutritional information as well. So our key information would be infographic or visual aids in terms of key messages. Our kind of target group would be the kind of groups that we work with within our Health Living Centre. So anything from parents with children to adults themselves, and then the older adults. So we work right across multiple demographics of ages and generations. So it's making sure the content is digestible to all those kind of age groups and demographics to make sure that those messages are applicable. So again, it is very generalized. We try not to be too specific so we don't exclude anybody in our messaging.
Yeah, brilliant. Yeah, and that makes every sense. Again, I'd like the visual side of things. I think that we all get that. We're all tired of too much text and too much instruction, whereas a couple of decent photographs, a couple of decent infographics can really tell the story so much better. So well done on that. And I think there's a huge amount of learning that we could all share on that, and maybe future for Safe Food in terms of support to the community groups. Again, little hint there, guys. Can I move to, if Marie-Therese, and question here is, and well done again, a great presentation, fantastic stuff, beautifully colored. I love all of those. Again, the graphics, just as Julie spoke about there, really well done to everybody. Marie-Therese, we know how valuable the steering group is for the community projects, but can you expand on the advantages of being part of this group to your school, to the pupils and their families?
Thanks, Ryan. That's a great question, actually, because that is the heart of what I do here. So in my role as the HSCL coordinator, while we have lots of supports in place for the children in the school, I'm specifically designated to the parents and supporting the families. So when you first come into this role, it's the kind of role that you have to make your own, and you nearly go out there and look for various different supports that are, there's lots already up and running, but you're always looking for something new and different ways to reach out to families. The Community Food Initiative was so good because it meant that I could go out in a very non-threatening way. I wasn't coming out to find out what are the problems in this household, I was going out in the same way that I would go out to any other family involved in asking everybody to get involved. It made the families that are most vulnerable feel the same as everybody else, if you know what I'm saying by that. And that it isn't specifically targeted at people who are disadvantaged, although people who are disadvantaged can benefit greatly from it. But when they see people, sometimes they feel like they're in a bit of a targeted group, and that makes them feel a little bit, and maybe a bit self-conscious. When they're part of a bigger group where there are lots of different people involved, and they see Mary from down the road who has no problems with her family and no problems in her home, this one brought them all together very well. And it also, like I said, it helped me to go out there and do those doorstep visits. I was stuck in my office on the phone a lot of the time trying to connect with these parents, but to get to see them face to face, there's no substitute for that home visit and getting out there and being a support to people. So even if all I did was get as far as their front door to drop off the groceries for the cookery program that week, it still meant that I could see them. I could see their faces. I could see generally how they were doing. I could get a wee glance in to see that the family was okay as well. It was very, very beneficial from a school perspective with regards to getting out there and actually seeing them.
Thanks, Marie-Therese. And again, I think what you've reflected there is just how important this program is in terms of its design. It's about people. It's about people coming from within communities to address this and working with the expertise that can then be accessed with the resource that we talked about earlier, the importance of having a few quid, having some way to pay for those experts to be with us. But it's about the community driving it forward, whether that community be the school, the parent, and with the support of the students and the involvement and often the direction.
Absolutely.
Thank you so much. Actually, can I bring Edel back in? I've got some general questions I'd like to ask, but Edel, particularly a specific question which relates to this in a way. It actually talks about the expertise and experts. So it's the question here, and it's come a few times, is can registered nutritionists deliver healthy food made easy?
Yeah, in theory, yes. The program isn't delivered for profit, if you know what I mean. We don't, when we train our peer leaders, they're delivering on behalf of organizations that we work with. So we don't deliver training to people who work for themselves. Do you know what I mean? So we don't charge people to participate in the program. But ideally, our best peer leaders are those that have been identified who have been participants in the program, who, you know, our peer leaders would always be on the lookout for people who would like to become a peer leader, and then periodically, then either locally or we hope from now on nationally, we would provide training. But of course, that could be someone with any qualification. So that's fine.
Okay.
But so no, there's no one excluded from delivering. But I guess we want our leaders to be as close to the communities that they're delivering to as possible.
Okay. I think that's good logical approaches as well. Again, back to taking a logical approach right through this process, and makes a lot of sense. Thank you, Dale. Yeah. Here's a question for everybody, and I'm going to go through the order of the panel. So this is really being unfair. And Marie-Therese was last and has to come up with something really cool or different. And Jennifer, you're up first. But the question is, if you could just highlight one tip for those designing community programs, what would that tip be? So this is something for you all to reflect on. Jennifer, take your time and
that's a good question, Ryan. Yeah, so one tip for those. I think what we have found is that you really need to develop them in co-partnership with the communities that you're wanting to deliver. So that's been a learning sort of over the number of years, that anything that you want to develop it in partnership with those you're delivering.
Great answer. You get 10 out of 10 for that.
I know, I'm glad I was first.
And Edel, you're next up.
I think they need to be enjoyable. You know, the content is you know, needn't be complex, but we do have a very high rate of completion, which for other programs that you would see, and I've seen a lot of programs come and go in the HSE over the years, you know, where you might have very few participants left at the last week. You know, if people don't enjoy coming, they're not going to keep coming. So you have to, and that, I suppose, it comes down to the facilitator as well. But like I said, like, because our facilitators, because it's an enjoyable program to both deliver and participate in, people continue to come. So and I think people like having the space to converse and just generally, you know, discuss in a very, you know, in a very safe, non-threatening environment their own circumstances and the behaviors around food, and I suppose that we allow enough time for that to happen in a very easy going, enjoyable, fun kind of a way. So I think the content is important, but that, I think the environment in which the discussions happen is probably the most important.
Thank you, Edel. And again, that very much links back into our previous question in terms of the qualifications. It's not just qualifications, it's that capacity to bring enjoyment, to bring some fun, to make it so that it's people want to come back. Yeah, people want to come back because it is some place for social interaction and enjoyment.
And by the end of the program, then you would be considering making changes, and they do make sustained changes to their food behaviors, which is what I suppose ultimately we're
absolutely
trying to achieve.
Yeah, for sure. Julie, the question gets harder to answer.
Goes down. So being good and effective communicators, I think, even as I myself, as I'm a facilitator within these programs as well. I think how we talk and engage with the participants that are on our programs, and even how we communicate to partners and organisations that we are delivering and facilitating on behalf of. I think being a good and effective communicator, to relay messages and to relay the content of programs to the participants in a way that they understand, they can really connect with, as well as being enjoyable and fun. I think them understanding the content and really being able to implement that in their lifestyle, in their life, is a key thing. I think being a good communicator and having good communication between all parties is an effective way to have a successful program.
Yeah, that links back into everything I said before, the capacity to communicate, the partnership that's built within that, the sense that this is together. This isn't me telling you, this is us working together on something. I think that's a really good point. Mary Trays, the pressure mounts.
No pressure here, but let's just think for a second that COVID is no longer there. We're planning for these community events again. One of the things I would say would be get some cool people involved. I mean, people who are cool to your demographic, people who kind of that the people your target audience, people they will look up to, people that they will like to hear from, people that will draw them in. Like, for example, if we were organizing something here in Donegal for the elderly, I might ask Daniel O'Donnell wanted to come for tea on the day, or I might find out if a GAA player that had great influence amongst the teenagers was available on the day to come and talk to them for a couple of minutes about healthy eating and how it impacts them on the sport. Or I might ask a YouTuber that, you know, maybe some of the younger ones are listen to and is local, and, you know, maybe be creative with who you get to advertise your events, because sometimes they come for one reason and then stay for the value of what's there when they get there.
Brilliant answer. No pressure. So that's really good, and that those are really 4 fantastic responses, because it gives everybody a really good platform on which to design. And that final point is really, really important, because it goes to who are we working with, who are we influencing. It's not about us. We're there. We're all bought in. It's who will make the big difference when it comes to the people we want, as Edel says, at the end of it all, to take home the messages and actually implement them from home. Who is going to influence them in that way? So the whole word influencers, I've only learned that word in the last while myself. I'm what I am. So it's really clear, and it's a really good way to look at it. Can I there's a few more general questions, but there's a specific question here from Julie again, back to infographics and what the hell do infographics mean and how do they look? And somebody asked here, will you be happy to share your Facebook page interested in the infographics that you spoke about and the visual key messaging?
Yeah, so I'll just start off with Facebook. So the handle for any social media that comes through the organisation I'm based at is OLTHLC, all capitals, and you'll find us across Instagram, Facebook, and Twitter. We also have a lot of our community organisations. The Healthy Limited Alliance you'll find on Twitter. Again, we share a lot of information on infographics across multiple sites and multiple organisations. Again, I can provide that list if these slides are being shared on the back end of mine. And then also infographics. So we use a great site, and many use maybe have heard of it, Canva. So what you can do in infographic is a one pager or one image that can have multiple sections of information on different sections that can provide visual aid on a summary, percentage, say a statement or a program. So how many people participated on a program, what the uptick was, what the disengagement was, all kind of key information. Or you could design it yourself. We can get ones designed up for us, or we can design it ourselves. So they do change. An infographic is just a one pager that has information explained in a visual kind of dynamic that makes it easier to read and dissect key information.
Yeah.
Hopefully that's it explained in a nice way.
Thanks, Julie. No, that's good, and I know that the guys in Safe Food will share these links later as well for everybody. I see people sharing there about Canva, etc., which are really great ways to actually learn how to design for yourself. And I've only again started learning a little bit about myself, and but they are brilliant, and it's incredible what these pieces of software can do for everybody. Now, I've got a general question here. It's from County Waterford, and it's a question I'm going to again go around the house. This time I'm going to reverse the order. Jennifer, the pressure's on you. This feels like a really bad quiz show, and I'm being a really bad quiz master, so hopefully this does make some sense. So I want to set up a community cookery workshop. Do I need a training kitchen? And what are the health and safety issues that I should be aware of? Read trays.
Okay, well, my answer on that one will be very short because I don't know. The reason I don't know is because I'm one of those ones who benefit from it without really knowing how it all works behind the scenes.
Okay.
I do know that for us locally here, we have used local chefs in their own kitchens. You know, when people who also that actually helped to get people on board because there were people whose restaurants everybody liked to go to, and so they took some time, and it was great to know that the chef from that restaurant was the one running this program, and then again people were interested in coming on board. But I believe that since it was in this person's own, you know, restaurant kitchen, it was already, everything was approved, and he already was aware of all of the paperwork and the red tape that would have to be taken care of there.
Brilliant. And you see, you knew an awful lot more than you thought. So well done.
Thanks.
Thank you. And thanks for that. Julie.
I would say from my experience, it would just depend on the type of cookery workshop that they're aiming to deliver. Is it, you know, one person delivering a workshop, or is it you deliver a workshop, multiple people cook? You know, after following a demonstration, if it's going back to face, you can't. Our experience is that we use our locally based kitchen here within our centre. We're fortunate enough to have an on-site kitchen, so again we would have that. But you tend to not need it if you have some cooking facility and you have staff that are trained in their food and hygiene or food safety standards. Then that's kind of a prerequisite to doing that delivery. If you don't have a chef or, you know, someone that is kind of experienced cook, and again being trained in one of the, I myself from being in the north have trained in food value, so there is a small experience there in delivering a cooking program. So it would just depend on the experience of the facilitator, what the type of aspect they're looking to deliver. Is it multiple people cooking, or is it just one person delivering a cooking demo? And kind of if they have those kind of relevant qualifications in food safety, and from my experience.
Yeah, no, it's good logical input. Idel.
Yeah, well, we wouldn't always have training kitchens by any means, but there would be, if we were beginning to work with a group for the first time and they had a kitchen facility, our coordinators would visit the kitchen before the program was carried out to see if it was suitable. So it certainly wouldn't have to be training kitchen standard, but it would need a minimum set of, you know, sink, you know, not even cooker. Actually, I think we've used mobile cookers, and if we tend to, if the circumstances were required to work the recipes and the program around the facilities to I suppose enable the program to get completed, you know, even if the circumstances aren't fantastic. So you might do different recipes that required less cooking facilities, you know, so no, we wouldn't use training kitchens.
Okay, that's good to know too. Jennifer.
Last but not least, I know. Yes. I think probably just following on a little bit there from Adele, all our sort of cooking skill programs, so Cook It and Food Values and I Can Cook It, has an element of food hygiene training embedded as part of the delivery. So we do cover sort of basic food hygiene information around that, and then we would also do a pre-visit prior to sort of communities coming on board with us. And at that visit, we would look at the facilities that they have there. So, you know, what cooking facilities, what kitchens, and most of the community venues and voluntary organisations would have a sort of a community kitchen, be it in a church hall or a community venue. And a lot of that would be linked into environmental health would have had an inspection. So we link very closely with environmental health officers in each of the local councils who would support sort of communities around that. But we would embed basic food hygiene training into our programs.
Brilliant. Thank you again for really good answers and for really logical answers. I've got about 3 or 4 minutes left in this part of this session, and I'm going to take a question that I want to ask, if that's okay. And mentioned that we're coming to the end of this current CFI and this current community food initiative. It's been a brilliant experience again. And the question I'm going to ask, and if I go through it in the order of Jennifer, Adele, Julie, and then Marie-Therese, and you've literally got one minute to answer this each or less. It's what could we do better in the next round of the community food initiative? Like, there's so many positives, there's so many great things that have happened. Is there anything you'd like to add or see added? Or you mightn't have an answer, you might just say it's perfect as it is, or you might say there's something in there. But Jennifer, do you mind taking that forward? I know I dropped it on you.
No, that's a good one to end on as such, Ryan. I think certainly, you know, for this round of the community food initiatives, safe food are very much embedded in that you need to make contact with your local dietitian or registered nutritionist. And I think that was maybe a gap that was there prior to that. So we want to work with communities, we want to work with organizations and to deliver our programs, but sometimes we're small in our numbers and we're not always aware of everything that's happening around us. So that link has been really, I think, fantastic in this, and I think it really promotes our working partnership with our local healthy living communities, so centres. So I think sort of having that in has been really positive from our perspective.
Jennifer, thank you, and thanks for that. Edel.
I think that back to the Healthy Community Initiative, that's coming up next year. There'll be improvements for us there that we haven't. It's not that we haven't measured or recorded who the program is delivered to, but I think we'll definitely be more specific about gathering that data at a national level. So this time next year we'll have much clearer information about exactly more detail about the people who are the participants of the program. So it'll better enable us to identify gaps in terms of the groups that we're trying to reach. I think we more or less do reach the groups that we that we set out to, but I think this is we'll have a more formal method of gathering those metrics and be better able then for 2023 to make sure that we are hitting the right groups and to maybe identify the people that we're not reaching.
Well done. Thanks, Adele. Julie.
I just following on from Jennifer and Adele. I think it's just kind of maybe establishing or highlighting the kind of the work that we are doing, maybe more an individual level across all our sites in the community. I think everybody does fantastic work in delivering these programs. I don't think people shout enough about them to highlight kind of that impact of the work that they are doing and how strong the links are across the board between community and statutory and public and local authorities. I think highlighting that. The video at the start was a key kind of insight to that. Some of the work that has been established. I think having more of those or having those shared more frequently can help, and maybe even something Marcia has spoken to. Having more people of influence that they certain demographics speak about that stuff that we are doing at our community levels will be more impactful going forward as well to highlight the programs.
What's that? Thank you, Julie. Marie-Therese.
Yeah, I have a couple of things I'd like to say here, and the first one is, as we've said already, our target is people and reaching people at a very real level. So I know that my aim as a HSCL coordinator is to connect with people, and I suppose it's important to not see them as numbers, to not see them as how many people are involved in a particular course. I have on my desktop here, I have a saying that I always kind of look to. It says, nobody cares how much you know until they know how much you care. So I think it's important that they see us as being people that are there to support, and then they'll want to get involved in the information that we have to give them, And the other thing that I think we really all should be taking away from the whole COVID-19 pandemic is that blended approach. It used to be that if people couldn't show up for an event, that was it, game over. Whereas now we can have the two. So let's use it to our advantage. We can say, listen, you can't make it. That's okay. We can record it. Here you go. You can have it by video. I think we can reach more people at a level that they're willing to connect with if we do that.
Yes. Brilliant finish. You all did so well, and thank you so much for that. And I suppose from my side, if I can just thank you all, thank everybody, but thank you guys for sharing on behalf of everybody just the experiences and the work and the partnership. That whole thing, like you all reflect a partnership. We all reflect a partnership, from the community to the local development to the state bodies and to the experts, and I think it's just fantastic. So well done to everybody. If I can wrap up, I'm going to hand over now to Sinead Conroy. Sinead is with CCAD, is one of our key development officers, and has been from a CCAD perspective, has been leading our link on this project for a number of years now. And I can only say on behalf of CCAD again, just how energizing this program is for us as an organization. We work through multiple programs, we work across multiple agencies, but this particular program has struck a heart within us, within an organization like us, and within people like myself, Sinead, Tony McCall, who's a coordinator on our social inclusion side. So just thank you to everybody involved, and Sinead, over to you.
Thanks, Ryan, and thanks to all of our speakers. I'm so delighted that we've been able to provide such an inspiring event today to celebrate the end of this round of funding for the Community Food Initiative. Just to remind you that the presentations are being recorded and that everybody who attended today will be emailed a link to the presentations once they are available to view. And we would be delighted if you could share the link with any of your colleagues who could not attend today. As Ryan mentioned, CCAD has been coordinating the Community Food Initiative on behalf of Safe Food for the past 6 years. The Safe Food started out in 2010 and has evolved and changed over the past 11 years, but the core objective has remained the same, and that's to create awareness of the benefits of healthy eating and to provide families with the skills and knowledge to provide healthy food options for themselves and their families. When CCAD started out with Safe Food, the focus of the funding had changed, and we were delighted to work with Safe Food to develop an initiative that over the past 6 years has made a real difference in the lives of the people who've taken part. We are very proud to have worked with a group of committed and imaginative people over the past 3 years, and this ingenuity was never more apparent than over the past 20 months. All of the CFI leaders worked hard to adapt their projects and events to a new form of delivery, and this has ensured that their participants continue to have the opportunity to gain new skills and knowledge that would help their families to eat more healthily. CCAD and all the other organisations who've been part of the CFI have learned the benefits of using healthy eating programmes as a means to connect with our participants and to provide a range of supports. This was all the more evident in 2020, a year that created new and unique challenges for everyone in the community development sector. And it was a year when the community development approach was very important for the effective delivery of the Community Food Initiative. Each CFI leader working with the steering group was tasked with designing small projects that would suit the needs of their own particular area. These projects brought people together to not only gain new skills and knowledge, but also to connect with other people in their own community. You know, in normal times, the CFI plays a crucial role in empowering people to develop new skills. But in 2020, this empowerment spread across whole families, where we saw children becoming more involved and learning how to prepare and cook healthy meals along with other members of their families. Participation in the CFI has allowed children and parents to interact and learn together to a much greater extent than in other years. The CFI has provided a very welcome boost to participants over the past 20 months, and indeed has managed to support the needs of a diverse audience throughout the island of Ireland over the past 11 years. The joined-up approach, which is followed by all of the organisations involved in the various steering groups, means that the CFIs are able to adapt content to meet the needs of their own particular area. I think each of the presentations has demonstrated the value of the support of the steering group members, and this contributes to the success of all the programmes. So with the assistance of members of their steering groups, CFI leaders are able to leverage in other supports and funding to boost the level of support provided to participants. This also includes providing access to resources created through initiatives such as Healthy Food Made Easy and Cook It, along with all the resources that are available to individuals and groups through the CFI Hub on the Safe Food website. So now that we've reached the end of the session, I want to once again thank everyone who contributed to the success of this event. The speakers, Jennifer, Edel, Julie, Mary-Therese, Ryan, Anne, and all the people behind the scenes in Safe Food who have looked after the technology today. Just one final piece of housekeeping. Safe Food will be sending out a short feedback survey shortly, so they would be delighted if you could take a few minutes to complete it. So thanks again, everybody, for joining, and enjoy the rest of the day. Thanks very much.